Critical thinking and decision making is an important skill and an important attribute for those in EMS. So let's talk about what that consists of. The diagnosis is going to be the label for condition. So this is going to be based on history, your physical exam, your vital signs, and this is going to involve both physical and intellectual activity. A diagnosis is the conclusion that the EMT reaches after assessing a patient about the nature of the patient's condition, and critical thinking is an analytical process that's going to be able to help solve problems in an organized and efficient manner. So the EMTs must be able to use critical thinking to be able to arrive at your diagnosis. Your traditional approach is just going to be to start by interviewing the patient. Clinicians have different levels of training, different levels of experience, the amount of time that they've got on the job, technology, and other resources to be able to reach a diagnosis. These techniques are going to vary among all sorts of clinicians, even in the same types of field. The first steps are going to be to gather your information, consider the possibilities, and then you're going to reach a conclusion. After that, you're going to figure out how these steps are implemented, and this is going to vary significantly among traditional clinicians, emergency medicine clinicians, and EMS clinicians. So you want to assess the patient. Figure out a list of conditions or diagnosis. This is going to be your differential diagnosis or the differential. And upon further evaluation, you're going to reevaluate that differential to get your final diagnosis. Here you've got an ER physician that's assessing their patient. Emergency medicine approach to diagnosis. The biggest thing we want to rule out is to quickly figure out and rule out any immediate life threats and treat those. Anything in your ABCs or any killer bleeds so that we can stabilize the patient. After that, we're going to return to gather any additional information that we've got, and we're going to focus on ruling out a worst case scenario. So again, going back to the example of somebody that has chest pain and difficulty breathing, which one is more serious? Which one is going to kill them faster in order to figure out which one we need to treat first or which one we need to target? So your traditional red flags are going to suggest if you've got any sort of serious problem or anything like that. And we may be responsible for multiple patients. Remember that we must be very efficient. Be available for another call as soon as possible. We work in an uncontrolled environment. We have very limited tools and very limited skill set to treat and work with our patients. And we have a narrow educational focus. We focus on emergency medicine. We focus on acute problems, not necessarily chronic problems. So really we're going to follow the same approach as an emergency physician. However, most of these are going to be abbreviated or limited. So we're considering the most serious conditions that are associated with our patient. So we either need to rule them in or we need to rule them out. And this is going to help us create a diagnosis. So think about how you can reach a diagnosis. But is your work done? Why is it not done yet? So your highly experienced clinician's approach to diagnosis in medicine is because they learn heuristics or shortcuts. So they understand pattern recognition. If a patient presents with this, this, and this, then more than likely this is what is the problem. So this features narrowing possibilities. If they present with chest pain and shortness of breath along with nausea and sweatiness, it's probably not a stroke. Okay, it's probably a heart attack. So this allows them to establish these patterns and then allows them to treat the patient accordingly. So this allows an efficient diagnosis and a prompt treatment because you've already ruled some of these things out. You also are realizing the limitations of shortcuts, so this understands the common basics of heuristics as well. The common heuristics are representativeness, availability, overconfidence, confirmation bias, illusory correlation, anchoring and adjustment, and search satisfying. So how can an EMT learn to think like an experienced physician? You need to learn to love ambiguity. We don't work in a world of black and white. There's all sorts of problems and all sorts of illnesses and injuries out there that aren't clear cut. So some things are vague. You need to understand the limitations of technology and people, and you need to realize that no one strategy works for everything. So we need to change our approach from time to time. And above all, you need to be able to form a strong foundation of knowledge. There are critical things that EMTs can learn from experienced providers. So adopting these attitudes can improve their capability to solve problems and work through difficult issues. Ambiguity and uncertainty will always be present in medicine. That's why we call it practicing medicine. And this is also going to be true in the back of an ambulance. Also, you need to be able to organize the data in your head, be able to process that data, and you need to change the way you think. This goes back to the one approach not working for everybody. Sometimes we need to come up with a different approach to treat that specific patient. Make sure that you're learning from others, especially more experienced providers, and reflect on what you've learned. Review each call with your crew member. See if there was something that you could have done differently. See if there's something that maybe you shouldn't have done. Many of the attitudes and understandings of experienced clinicians focus on flexibility. This is an extremely important trait for a new EMT to develop.